So again, this is the review slides for the lecture that looks at clinical assessments and also ethics and legal issues in psychological tests and measurements. As always, these are a brief overview of just some main points and kind of the big picture from the more detailed lectures and textbook readings. So an overview of clinical assessment, basically, what are we trying to do when we're doing a clinical or counseling psychological assessment? And generally the questions break down to as the diagnosis. So does the patient have a mental disorder? If they do, what is the diagnosis? What is the current person's level of function? And generally speaking, that's really a major point that we're looking at when we're using psychological clinical assessment. We're trying to determine how well is the person functioning. If the person is behaving very oddly, but they function well and they're not suffering any kind of distress in their functioning, that isn't necessarily the indication of a disorder. It's when there is a diagnosable disorder and the person is having either a level of function that is not allowing them to successfully interact with their society and within the roles that they have, or they're experiencing distress over their level of functioning. So how does their current level of functioning compare with others in their cohort? So again, trying to individually measure where the person fits quantitatively or numerically in the range of normal functioning. And then once we have that diagnosis, once we know there's an issue, what type of treatment can benefit this individual, and again using psychological assessments, clinical assessments in this case, to determine is that treatment being successful. We can also use these assessments simply to help describe a person's personality, to provide feedback to that person in a more counseling setting. So this is the kind of person that you are based on your clinical assessments. What do you think about that? Do you enjoy being this type of person, or is this something you're wanting to work on? Are you wanting to try to change? So when we're looking at the diagnosis factor, we're kind of leaving the field of pure psychological assessment and also recognizing the real world of practical concerns. So when a diagnosis of a mental disorder is made, there's a couple of things that are firing in here beyond just whether or not we're measuring a construct of mental disorder. We're also having to recognize that there is clinical decisions being made. So is someone going to be actually forced into treatment? Is someone a possible danger to themselves? But there's also a medical and medical insurance factor of, is this a disorder that's recognized by insurance companies, by hospitals, that can then also provide resources to deal with that problem. And so because of this, our psychological assessments in a clinical setting are often driven more by this kind of business medical model. And the DSM, which is the current diagnostic manual of the psychiatric profession and is also used in clinical psychology, basically codes people into 5 axes of disorders. So axis 1, 2, 3, 4, and 5. And you can kind of see that, there's different factors, but a lot of things are being put together. So axis 1 includes disorders of infancy, includes dementia, but also schizophrenia. Level 2 is mental retardation and personality disorders. Axis 3 is physical conditions that may affect mental functioning. Axis 4 is different problems of sources of stress, marital, occupational, so kind of state-based influences on mental disorders. And finally, Axis 5 is a global rating of overall function. So the clinical interview is a major part of clinical assessment. So clinical assessment can include a battery of tests, including the DSM, which is a checklist of symptoms. It can also include a clinical interview that gathers information for the DSM, but also provides the clinician with additional information to help make a diagnosis. So again, the clinical interview can be conducted for several reasons. Often it is used for diagnosis. Sometimes it may simply be used to pinpoint areas that need to be addressed in psychotherapy. It can also be used to determine whether an individual is going to be of harm to themselves or others. And again, there's a legal impetus here, as most states and regions have what is called mandatory reporting, that if a clinician finds out that someone is likely to harm themselves or others, they must report that to authorities that can take action. And it can also be used to guide decisions about what else needs to be done to assess the individual. So there's several applications of clinical measures beyond actually what we just talked about. Clinical measures can also be used in forensic psychology. So this is the application and theory of psychology to the measurement of legal context, generally criminal behavior. And again, various court casings have found that basically clinical psychology is called upon legally to determine if people are dangerous to oneself and others and may need to actually be legally committed for treatment, whether they're competent to stand trial, and also whether they're capable of understanding criminal responsibility. Additional clinical assessments may be used to help in the decision making for parole and probation, and also to evaluate emotional injury due to criminal acts. And it can also be used within law enforcement to help provide criminal profiles based on a particular set of crimes to kind of determine what is the person most likely would be committing these kind of crimes. What would that person act like? What would be some of the symptoms or behaviors that might help police find the person they're looking for? So the psychological report, okay, we just talked about that. So looking at general ethical principles for testing, again, moving away from clinical testing to just ethics, one of the big things here was to ensure competence. That there are multiple ethics that are involved in testing, including informed consent, including rights to see the response, including protecting the actual integrity of the test. But one of the big ones is the person giving the test actually competent? Does the person understand the methodological aspects of the test? Is the person familiar with the administration procedures? And do they know how to interpret those tests? And all three of these need to be considered before someone starts actually using a psychological test. We also briefly reviewed the laws that protect testing. So the 14th Amendment, all U.S. citizens are protected by the laws. So if the test in any way may restrict rights or opportunities, it may run into the actual Equal Protection Clause. The Civil Rights Act includes equal employment opportunity, and basically, so if a test can be shown to actually be biased against a particular protected group, or have different outcomes for particular groups, it may actually be violating federal law. And also the Americans with Disability Act. So just because someone actually is diagnosed with a mental disorder or a physiological disorder that affects psychology and behavior, there is legal requirements that actually reasonable accommodations may have to be made for those disabilities. And finally, we talked about adverse impact. And again, adverse impact is just the bar that is set by U.S. federal regulations, the Equal Employment Opportunity Commission, and actually Title VII of the Civil Rights Act. And what it basically says is that any time you have protected groups, so that can be gender, that can be religion, that can be ethnicity, that can be national origin, if it's a protected group and you're hiring people from those groups, you always have to look at whichever group actually has the highest percentage of acceptances. So in this case, for example, we're just going to look at the top line. Males, 200 took the test, 130 passed. So 130 divided by 200 gives us the actual percentage that passed the test, 65%. If we look at women, 125 took that test and 60 passed. So again, 60 divided by 125 is 0.48, so 48% of them pass the test. What adverse impact says is that basically once you've found the group that is hired the most, the highest percentage, all other groups have to be hired at a rate of at least 80% of that percentage in order to not be violating the potential of adverse impact. So in this case, we take that 0.65 of the written test divided by 0.8 and we get 0.52. So any group that's being hired at a rate of less than 52% is suffering from potential adverse impact. Once again, women, only 48% pass the test. There is the potential for adverse impact. In other words, a protected group, women, are being hired at 80% or less than the rate of the men that are being hired. Now, this doesn't mean immediately that the organization that is doing this is violating federal law, but it does mean that they're now have missed a marker, or it is much easier to bring a case against them saying, hey, why is this happening? Now, the company may then defend, well, there's a reason. Women just literally aren't as good as the test. Maybe this test was actually, instead of a written test, it might have actually been a strength test. So if you can show that the test actually is directly related to performance, and that a particular group just does better for various reasons, then you might still be able to keep using that test, even though it results in adverse impact. But generally speaking, when we find adverse impact, the question is that test really necessary? And is there possibly a better test that would also give you information about performance that would not also be adversely affecting a protected group in the United States?